was wonderful to hear all your experiences. I think the spirit of these series is I will share a little bit of background, but really to have a conversation, I think, with each other and share insights and ideas about really how do we do this work well or better. And talk a little bit about some of the current thinking in the field. There's been lots of developments around how do we think about psychological health and safety. So we'll kind of give you a bit of background about that will set up for our discussion. So a bit about me. So as I mentioned, I have been doing this work for about 15 years, at least 15 years. And I started with healthcare. So I was a healthcare worker. I was really interested in understanding the experiences of healthcare. And so my PhD work back in early 2000 was really trying to unpack a little bit about all the silences and stigma surrounding mental health among healthcare workers. And that began a journey called Beyond Silence, about how do we move beyond the silence. And so we started with the development of a workplace mental health training program, and we did a randomized clinical trial actually at St. Joe's and HHS. And then we did had funding from the Ontario Ministry of Labour to do a rollout of the program in small, under-resourced workplaces across Ontario, and it's been a real journey to think about their needs. And then I seem to have landed in the mobile health field. I've actually been involved in 2 app development projects, so one for healthcare workers and one for the first responder community. And really thinking about how does technology do this work or not do this work well? How can we link to peer support? And what does that mean? And I've also been involved as the co-chair of the Workplace and Education Environment Subcommittee at McMaster, thinking about how do we create spaces at McMaster to support faculty, student, and staff mental health. So just by way of that, I've been very fortunate to have funding through CIHR around the app projects through Ontario Ministry of Labour, and we now have Movember funding. Really interesting to do some of this work around the first responder community. So that's a little bit of where I'm coming from. What I'm going to talk about today has nothing to do with these, but it certainly shapes, I think, a little bit of how I think. And again, many of you come with your own experiences and insights, and hopefully this will be a chance to kind of share some of your learning as well along the way. Oops. So what we're going to do is I'm going to talk for a little bit, maybe 10 minutes or so. I'll try to make it short, and talk about what do we mean by psychological safety? How do we assess safety in the workplace? And how do we do things differently? So how do we establish safety in our workspaces? So definition, I don't know, you may have some thoughts. You can pop your ideas in the chat. What do you think psychological safety is or isn't? And just to say, when I first started this work, I remember talking to someone in Occ Health and Safety, and he says, you know, I'm just trying to make sure people don't slip, trip, and fall. I'm not really thinking about mental health. So really, traditionally, safety we've thought about as a physical safety in the workplace. And I think with COVID, there's been lots of attention to physical safety in terms of distancing and masks and protocols around that. And now I think there's really a shift to thinking about mental health and psychological health and safety. And there is a term I really like that's really thinking about, you know, now we're in a service economy. So the heavy lifting is not done so much with our backs, but with our minds. And so we need to really pay attention to thinking about psychological safety in a new way. This is a definition of psychological safety that's a pretty traditional definition, thinking about this idea that people feel safe to be able to share ideas, to question, to speak up, and that they're not going to have negative ramifications for themselves and their work. It does not mean that everybody is nice all the time. It's not that. But it means that you can embrace conflict, you can speak up, knowing that your team has your back and you have their backs. So that's kind of where we'll start, is this notion of psychological safety. Since I'm going to actually go a little bit beyond that, there's actually been quite a bit of work looking at what are the dimensions of psychological health and safety in the workplace. So a bit broader than that definition we just talked about. And so this idea that there's a vision for psychologically healthy and safe workplaces that is about preventing harm and promoting psychological well-being. Quite broad. And there's some interesting language, I would say, in this definition that talks about preventing harm that's intentional, but also could be negligent. So really saying that employers have a responsibility now to pay attention to this notion of preventing harm and be intentional about things that they do. And so about 2013, there was a voluntary standard developed by the Mental Health Commission of Canada and the Canadian Standards Association. You may have heard of it, saying that sort of there's this outline of what a voluntary standard should be for employers to take up. And this has really put Canada on the map. We're seen as kind of world leaders in terms of moving the field forward and thinking about this notion of standards that employers should meet. And this, we talk about the standards as a vision and this notion of a journey. So we're trying to get there, but it's a journey along the way. And this is a quote from the standard, really talking about what we mean by psychological health and safety. And it's very much embedded in how we work day to day with each other. It's embedded in working conditions, in management practices. And there are many, many things that affect our mental health. And this standard isn't really about all those other things in our personal lives. It's really saying, what can workplaces do? What are things that are within the control, responsibility, or influence of the workplace that can have an impact on employees within them? So that's a little, and the standard has I can give you the link. There's certainly lots of details in the standard. One of the things that they have done is really start to identify these psychosocial factors. And of course, I can't talk about workplace mental health without a Dilbert cartoon, who really, I think, has a bit of a commentary on our workspaces these days. And this one, I think, really speaks truth to the fact that many workplaces are now paying attention, I would say, to employee health and well-being. There's a very clear business case for doing this work, but the messaging is not always consistent. And there's questions as to whether leadership is really committing to doing something different. So this is about the 6 a.m. meeting about employee health and wellness. And so yes, it's okay, but as long as it doesn't interfere with your productivity at work. So I think thinking a little bit about the importance of leadership and real commitment to authentically making a difference. So I hope that you received I think there was something that was circulated to people outlining each of these 13 factors with the definitions. I'm not going to go through all the definitions here now, but just to say 13 factors is a lot to hold into your head at once. But they're really starting to unpack and do some work around what are these psychosocial factors? How do they influence? Thinking a little bit about what's important in our workplace. Workplaces are good at some things and not at others. And how do we understand what's important for employees in your workplace? Individual employees, but also collectively as a workplace. And I would say for those of you in healthcare, they've actually added 2 more psychosocial factors. The 2 that they've just added are protection from moral distress. So there's lots of attention to moral injury for healthcare workers around PPE and not being able to do your job and some of the challenges of COVID. And then the other is support for psychological self-care. So again, actively supporting staff to take care of themselves. So for those of you that had a chance to review the psychosocial factors, I don't know if there's ones that particularly stood out to you. We'll have a chance to dive into these a little bit more later in some of the breakout rooms. I'll maybe keep going for now, but we'll come back to these a little bit later. So what does it mean to assess psychological health and safety? There's an organization called Guarding Minds at Work. They're based out of Simon Fraser in BC, I think. They're clinician researchers, and they started to develop these free tools for employers around assessing psychological health and safety. And they've developed over the years, it's now quite a robust website. You can go and have a look. They talk about one of the tools is an organizational review for senior leaders to look at policies and practices in relation to the psychosocial factors. They have a stress satisfaction scan. So if you want to do a quick scan of employees, looking at the extent to which they're stressed or satisfied at work. And then this employee survey, which is a bit longer, that actually dives into employee perceptions around each of the psychosocial factors. And so this picture here, and I apologize, the printing is really small, but it shows you an example. If you do this employee survey, this is kind of what might come back to you as an employer. So it really, you can see here that for this workplace, there significant serious concerns really perhaps around employee engagement, growth and development. So you can see how you're doing better on some things than others. You might say, how do I know? Is this okay? Is this not okay? One of the things that they've done is they've developed, they've kind of surveyed a large, I think it's like 500 employees or something. So you can actually have a benchmark to compare your organization to other organizations to see maybe how you fit as a workplace. I can see there's some things in the chat. I'm just gonna, sorry, have a look here.
Yes, I was going to say one that immediately jumped out to me right off the bat was clear expectations and leadership. I definitely benefit from having things outlined and being able to spell out criteria for certain things. I think the less guesswork that's involved, the more I know how to better do my job and the less stressful it is.
Beautifully stated. And we are definitely going to tap into, so leaders make a huge difference. There's quite a bit of research talking about the importance of leadership and supervision in supporting psychological health and safety. I've just put this up because the Guarding Minds at Work talk about, they've pulled out a few that are specific areas of concern. So these are ones that if you see this in your workplace, you want to take action. That can lead to certainly serious threats to psychological health and safety, and you want to prevent and immediately address these issues. So again, could result in litigation, grievances, complaints, or health concerns. So this notion of discrimination, bullying and harassment, unfair treatment, trauma, feeling burned out at work. So again, these are really important ones to pay attention. They're all important, but these are ones you really need to pay attention to take action. Another tool that I really like is actually put out by the Occupational Health Clinics for Ontario Workers, which is based in Hamilton. They have this lovely stress assess tool. And you can, if any of you got your phones there, you can have a look. There's two versions, a personal edition, so you can actually go in yourself and fill it out. And there's a workplace edition where workplaces could give this out to their employees. Again, it's free. It's evidence-based, and it really, again, is designed to help workplaces identify psychosocial hazards that lead to stress and mental injury, and comes up with suggestions and pathways to address them. And again, I showed you the report from the other one. This one also comes out with a similar report with kind of this red, yellow, green about how your workplace is doing. And there is overlap, I would say, between the two. This one is actually based on the Copenhagen Psychosocial Questionnaire. And the benchmark for this survey, they have about 4,000 workers across Canada that you can compare your workplace to that benchmark. Oh, someone's putting the pops in the chat. Thank you. And then we get to leadership. So again, Megan, you very astutely pointed out that leadership is really important. And again, sometimes we have the right people in leadership and sometimes we don't, and the same with frontline workers. So again, we're in service-oriented position. It really matters who the people are that we work with. And I believe that we sent around the link. This again is a free tool. It just came out this year, 2022. So it's kind of hot off the presses. And this tool, you can do a self-assessment if you are a leader, to do your own self-assessment. You can also ask employees to fill it out to get feedback for yourself. It takes about 20 minutes to fill out, and they have a number of different dimensions within it. So communication, collaboration, social intelligence, problem solving, conflict management, and security and safety, and fairness, integrity. Again, if you're interested, this can be a little bit of a breakout activities to dive into this a little bit in terms of where you think you fit and things that maybe you're good at, I would like to develop further. And there's again been some interesting research. The tool is relatively new, but sort of how you might compare to other leaders in terms of how you're doing around you as a leader in psychological safety. And then I just want to, so those are kind of strategies, free, I think evidence-based, really good tools around assessment. I think if you're going to do anything around addressing or assessing psychological health and safety, there's been a real movement to say it's not just a matter of finding a survey and sending it out to people. There's quite a lot of discussion about if you do anything, it actually needs to be in an organizational plan. You need to have buy-in from leaders. You need to think about, is your organization ready to do this work? Think about your strategy, have a communication plan. People are survey fatigued. People don't want to fill out any more surveys. You need to show that you're actually going to take action, have a committee and evaluate and choose your next steps. So there's lots of, I think, attention to this needs to be within an overall plan. It's not just a matter of sending another survey out for people to fill out. And this picture is actually from the Stress Assess. Same thing, it's a 5-step approach. You don't just send out the survey. You really want to think about how this fits in your workplace. And I think the next one here is also an action framework. So this is the Mental Health Commission of Canada. They've actually mapped on the action framework to LEADS. So some of you in healthcare may know the LEADS framework. So again, thinking a little bit about preparing leaders, engaging others in the process, and really thinking about this isn't top down, this is top down, bottom up, and everything in between. I always say if you really want to create change, you need all kinds of buy-in to do that work. So I think that's really what I wanted to say to kind of set up our discussion. How am I doing, Enid, Ines, for time? Okay?
You're perfect. Yeah.
Okay. So I think what we would like to do is have a chance to share insights, experiences with each other. I think Ines has controlled to set up a breakout room for us, and I think I will give you some choice as to what you want to do. So one could be the psychologically safe leadership. So if you're really interested in what it means for you as a leader, how do I lead in a psychologically safe way? I actually have a kind of a worksheet for you to work through, and you can talk a little bit about what are your strengths as a leader, what are your areas for improvement, are there strategies you can put in place to strengthen yourself as a psychologically healthy leader. The other option, if you're interested, is to think about your workplace. So what are the strengths and areas of improvement in your workplace and strategies that could be put in place to strengthen psychological health and safety? So I think we'll give you some choice as to how you want to spend the next, do we have 20 minutes, Eunice? How am I doing for time?
I think maybe we make it 15 so we
Okay.
can have time to debrief and discuss as a group.
Okay.
Is that okay?
So let me stop sharing for a moment so I can actually see you.
And you know what would be helpful, Sandra? Maybe just to put the questions in the chat so when we go in the breakout rooms, they can see the questions.
So the questions are in your
Right.
Google
in the
Doc.
Google. Fantastic.
So you can use the Google Doc or not as you wish. I just created the Google Docs to, because they have the definitions of all the different things, so you can look at those. You can fill it out if you want, or not if you want, it just as a springboard for dialogue. And the questions are at the top that you can fill in.
Perfect. So should we break into, we are 11.
2 groups.
Should we break into 2 groups? Okay.
And do you want to set it up so we can choose our breakout room? Do you know how to do that?
Let participants choose room. Yes.
Yes.
I love Zoom. It's
Getting better.
yes.
So I think if you want to choose room 1, you can do the psychologically safe leadership. And if you choose room 2, you can look at the psychosocial factors in the workplace. Does that make sense?
Leadership.
I love Megan's icons. This is my new Zoom thing.
So the first one was safe leadership, and the other one is the psychological factors.
So one is really thinking about you as a leader, the other is thinking about your workplace. So choose the one you want to go to, and you can work through that Google Doc if you want, or just use that as a springboard for your discussion.
Okay, so I'm just gonna open the rooms, and I guess everyone you can go into the rooms. Okay, let's see.
So I think you have to
Do you
click.
see the rooms? Are you able to choose?
Okay. And it's nice if we have a mix. Perfect. Good.
All right. So Sandra, do you want to go in one room and I'll go in the other?
Sure.
Does
Do you
that
want to
make
be a
sense?
leader or do you want to work on the workplace?
Both are good.
Oh, and look, we have a split. What a nice
Okay.
group.
I will go with maybe room 2. What was room 2?
Room 2 is the
The
psychosocial
workspace.
factors. Okay.
Okay.
And I'll go to the leader one. Okay, sounds good. So I'm
Perfect.
going to 1. Is that right?
Okay. Yeah. Now I didn't set it up for time.
Oh, do you want to?
I don't know how
So you
to
haven't,
do
you're in
that.
charge of the breakout room, so I think you can tell us when it's time to come
Yeah,
back and you can
I
send
think
a
so.
message to us, right?
Yeah.
So we
Yeah.
have till 8:45? 8:50?
Yes.
8:50.
8:50. Let's
Okay.
make it 8:50. Yeah. Okay. See.
Kim, before we disappeared out of our room, I noticed you had a little friend on your shoulder for a second there. Who was that?
Yep,
Yeah.
Sammy, my parrot. Let's see if he come back.
Okay.
There he is.
Oh, super cute.
It's so beautiful.
Does he talk?
He does, yes. His favorite thing to do is interrupt Zoom calls.
Gotta be careful what you say.
We should have a session about show your pet or let your pet
Yeah,
talk or something.
absolutely, absolutely. So Enos, I know I don't want to keep people longer than they need to, but we had a really great discussion and I feel like we'll highlight a little bit we did and then we'd also like to hear kind of where you got to. And not everything that we said, but kind of the highlight reel around where you went with this discussion.
Anyone from our group wants to share a little bit?
No, I think I kind of damped the whole mood with one of my area that, we were supposed to discuss about what is going well or positive things. And then somehow end up, I was loading off whatever is in my chest. And then it was amazing that I got a lot of support from you guys and also some of the great tips that where I can start having a general conversation that what is our vision, where we want to go as a change in the whole culture. And also some of the great tools that, Anas and Heather's were talking about. And I'm definitely started having some conversation and having some small group discussions or, go from there. Because one of my unit that I'm supporting, we need some major changes. And then, as I said, problem was always there, but during last 2 years of the COVID and a lot of workload, stress kind of pushed over. So I think this has been a great therapy for me tonight.
So it's all about, we got to support each other, right? And I think sometimes the psychosocial factors sometimes put words to, oh yeah, that's the thing. That's the thing that we really need to pay attention to. There's many things we need to pay attention, but this is the thing. If we could solve that, that's the first step. And I don't know, I'll go back to my screen because we talk about micro, like starting somewhere. You're not going to fix it all at once, but start somewhere that's manageable, that can have some returns on investment quickly. That's where you want to start to make change. And I realize that I can't share a document if I'm not the host, but I will share with you. I think, Enos, we have our people's email addresses. There's a beautiful, beautiful document that goes through all those different dimensions of psychological health and safety, and it has tips or strategies. I think I started to fill it the first section. There's actually more than that as well, and there's live links and things like that. So it'll give you some ideas to get going and that you can bring forward with your team, because that's what you want to do, is start as a team. Let's identify, let's articulate what this is, and then these are some ideas of things we could do differently.
So I made you co-host right now. So if you want to share anything, you can, absolutely. And we can also send handouts or further reading by email after.
I can't do it as a co-host. I think I have to be host, but it's also big. I can just send it after. That's fine.
All right. So maybe we can hear from the other group a little bit about leadership.
Yeah, Ashley took some really great notes, but she asked me to go and present it to the rest of you. So yeah, I think we had a lot of great skills that our group was talking about. So we broke our strengths, or for leadership, where our strengths were, our areas for improvement, and then how we can improve and strengthen those areas. And so there was a general trend, I think, of supporting our team members. So building a team together and hearing like other people who are on our team. We talked about the generous assumption. So if someone is performing poorly, to not assume that they don't want to do well, but to assume that maybe there's something else going on that you don't know about, because people don't show up to do poorly. That's, not what most people do. To focus on a strengths-based approach instead of deficit-oriented approaches. And in that same vein, letting people know when they're doing well, because often the feedback that people get is just only negative. So we talked a lot about that. And so our areas for improvement was mainly that us as leaders, we don't take on all the things that we want for well-being that we would want our, let's say, trainees to do. So taking time off, only doing things that actually serve our main purpose. And instead, as leaders, we kind of take on all of these other things, and we keep filling up our cup even though it's overflowing. And so our general strategies to overcome these areas for improvement would be to set some boundaries, rehearse how to say no. And also we had a suggestion of rehearse how you can politely recommend someone else for the job when you don't think that you are capable of doing it. So yeah, we talked about being a role model and setting examples for how you can take care of yourself, so that your own team can see that they can also take care of themselves.
That's a wonderful summary and great tips.
We had a great team.
We did. Lots of great insights. And I think this is, here we go, micro changes. There it is, micro changes. That's where you want to start. This isn't about boiling the ocean. This is about starting small. And then also don't do it yourself, right? You need a team. And start with, things that are easy, have the greatest positive impact. Those standards, when they first came out, there's they're pages and pages and pages and pages, and you think, oh my gosh, it's overwhelming. There's all these things we have to do. There's 13 factors. Now there's 15 factors. There's all these things I have to do as a leader. So I think there's been a lot of efforts to try to say, where do I start? How do I start this work? And I'll just leave you with some resources. There's many out there. So, after the standard came out, there's this action guide for employers about where, how do I start? How do I make this manageable? There's some really neat work out of Australia. They have really done a lot of great things around workplace mental health. This is one of them from Beyond Blue about developing a workplace mental health strategy. This is health services specifically. And then if you haven't found this website, it's amazing, Workplace Strategies for Mental Health, all kinds of free, easy to access, practical strategies and tools and workbooks. And so again, those would be some recommendations if you're looking to do more work in this space, about some website resources that you could have a look at. I think that's it for me. And I'll send those that really great list of action strategies as well. And I think someone had recommended, was it you, Ina, said we should all commit to something. So do we want to all commit to doing something different, whether it's a change in your workplace or yourself? We don't have to say them out loud now, but maybe write it down for yourself around, we just had this great conversation. Maybe it's just calling a friend and venting. That is so therapeutic. I totally agree with you. I'm there. I know Ines and I were talking about battle buddies. This idea of just having someone I can talk to and vent to is actually maybe the thing that we do.
Yeah, so you can also email yourself and check that email, put it to follow up in like a month or something. If you want to email yourself with something to commit to, and put a reminder so it comes back to you in a month. So I do that sometimes to keep myself accountable. It's like, oh yes, I said that. It's 9:01, and in respect of everyone's time, this hour I know has passed really very fast for me. I really enjoyed every minute of it. Thank you so much for joining us during this time. We hope to see you the next time. The next time, Dr. Catherine Munn is going to present about how to tackle microaggressions and mistreatment. So again, building on that thought, the psychological safety and that domain. Thank you so much and have a great night.
Thank
Take
you.
care.
Thank you.
Take care, everyone.